The following portion of Studio 512 was sponsored by CPI Health. Even if you're in long-term back pain, a big surgery just may not be the right fit for you. Capital Pain Institute offers minimally invasive alternatives, and Dr. Andrew Phillips is here to tell us more about them. Dr. Phillips, what are some of those minimally invasive alternatives to something like spinal fusion?
Yeah, so we get that question all the time. You know, patients are coming in and they're like, I just do not want surgery. And, you know, we'll be the first to tell you if there's something that we see that's like, maybe we should have a discussion about this. However, most patients have a lot of options at their disposal. So, for example, maybe they've done some other injections before, maybe they haven't, and you know, we can always go down that route. But beyond that, we have a ton of other interventional or other minimally invasive procedures to offer.
And you've touched on it a little, doctor, but will you give us some of the benefits of these minimally invasive procedures?
Yeah, absolutely. I mean, I think one of the coolest things that I love coming to work every single day is I have these very easy options that patients have never heard of that literally take maybe 10, 15, maybe maximum 30 minutes to do. And again, like I said before, walking out that day, if a little skin incision is required for any reason at all, it's really a skin incision. A lot of the recovery is skin incision recovery. You can get these things done, and our goal is to fix your pain and to fix your pain long term.
Something else that I think is really important to bring up is, you know, lower risk of infection or complications following something, you know, that would be big like a surgery.
Yeah, absolutely. I mean, the good thing about these procedures are that infection risk is very low. Because they are so minimally invasive, pain is much less after the procedures as well. And like I might have mentioned earlier, a lot of these things, you see some big changes very, very quickly. And also the alteration of some of your movements and ability to walk better and move better afterwards will just fix things long term.
Who would be a good candidate for some of these alternatives?
So the patients we're looking for are patients with chronic lower back pain, chronic neck pain, other chronic joint pains as well. Once they walk in the door, it is our job to determine what is causing that pain, and we will set up a game plan of what the next steps are and what steps moving forward could be.
What kind of recovery can someone expect after these procedures as far as, you know, shorter downtime?
You tend to see a lot of relief very quickly after these procedures. And what I've touched on before is they're walking out that day anyway. The recovery compared to some major surgery is just not even in the same ballpark. I'm usually trying to encourage my patients to start walking and moving pretty much right after we're done. And they do. And they tell me that the pains that they've been having are significantly reduced.
Sounds good to me, Dr. Phillips. Thank you for your time.
Absolutely, it was a pleasure. Thanks.
Capital Pain Institute has multiple locations in the Austin area. Find the one nearest you at capitalpain.com. The preceding portion of Studio 512 was sponsored by CPI Health.